Okay, well, welcome everyone. Everyone both in person and online. This is the sixth annual Global Health Intern Symposium. And my name is Dr. James Orbinski. I'm the director here at the Dahdaleh Institute for Global Health Research. And I'm really delighted to be hosting this event. As I say, it's the sixth annual Global Health Internship Symposium. And we've had great success over our 7 years now as an institute, cultivating internship among students and helping them grow in their areas of focus and helping them develop both the skills, the knowledge, the culture, and the attitudes that are really, really core to meaningful global health research. Today, we're going to be showcasing some of the contributions, not all, but just some of the contributions of 8 of our global health interns. What I just in having looked at some of the presentations very briefly this morning, what I see is just exceptional work on every front. I'm delighted, really, really delighted to have this opportunity now to hear you talk about your work. But before we get started, I'd like to start with start by acknowledging the land that we're on. This is a hybrid event. Of course, some people are online, some people are here in person. And so for those online, I just encourage you to acknowledge the land that you are on, or the territory that you are on, and give it appropriate gratitude and respect. We are here today physically at the York University campus here in Toronto, and this territory is known as Toronto, and I acknowledge and we acknowledge its current treaty holders, which are the Mississaugas of the Credit First Nation. This is also the traditional territory of many Indigenous nations, and this includes the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and of course the Métis people. And this territory is subject to the dish with one spoon wampum belt covenant, which is an agreement to peaceably share care for the land that we're on. And I don't in any manner profess to be deeply knowledgeable of Indigenous perspectives, but what I do know is that the land, as Indigenous peoples very rightly, in my view, call it Mother Earth, is the source of all being, and to the extent that the land or Mother Earth is healthy, we are healthy, and to the extent that we ignore respect and gratitude for the very thing that gives us life, is to the extent that we are unhealthy. And from a global health perspective, it's extremely important, at least in my view, to acknowledge this and to give it form and to give it shape through the things that we do and how we actually behave and what we work on, what we think about, and then how we actually engage in appropriate relationships with each other as human beings, but also in appropriate respectful relationships with each other and with the biosphere and or Mother Earth, as I previously described, requires. And so the work that people have been doing here, and most especially the work that we're highlighting today among the global health interns, I think is in toto a stellar example of exactly that kind of thinking, exactly that kind of giving form to right relationship, either to each other or to and with biosphere or Mother Earth, as Indigenous peoples refer to. So this symposium today is our 6th annual Global Health Internship Symposium. And what are we trying to do at the Institute? Well, overall, what we're trying to do is cultivate critical problem-solving approaches to contemporary challenges of global health. And when we say critical problem-solving, there's actually a lot of meaning in those three words. And when we think about critical theory, for example, critical theory is a very valuable theoretical perspective that allows us to illuminate and better understand the particular nature of a phenomenon, whatever it may be. And the idea essentially is to illuminate those biases, those fallacies, those incongruencies within a particular understanding of a particular phenomenon. So being critical is actually really, really helpful. But if you're just simply critical, it can be quite destabilizing. And while the intention of critique is to change, if you don't engage critique with a view to practical problem solving, your critique can sit in the ether of irrelevance, frankly. And so what we try to do at the Institute, in virtually every aspect of our research, of our symposia, and so on, is engage a critical problem-solving approach. We want to illuminate a problem, but we want to do so with a view to understanding it so that we can propose changes and interventions. And so that we can, based on that illuminated understanding, we can test new ideas. We can test ways forward. And so being critical with a view to problem solving requires a particular approach, and we take a scientific approach. We don't simply critique and then do. Right? We think carefully about an understanding, about causality, and about the complexity of relationships that might be illuminated. And then based on that, we engage the very basic principle of the scientific method, which is to propose a hypothesis, to design an understanding of that hypothetical proposal, and then to create a testable intervention, and which means that we test an intervention so that we can evaluate whether it's actually true or false, whether it's actually effective or ineffective. And here at the Institute, the three principles that we value most are effectiveness. So whatever it is that you propose or that you seek to do has to work. So it has to be effective. It has to actually implement, or it has to achieve the effect or the impact that you desire. Right? So that's actually, it sounds so simple, but it's actually not that simple. There are many things that are proposed and that people do. And however well-intentioned they are, they're not effective. So effectiveness is really, really important. The second principle is equity. And equity is a particularly important principle because what we seek to do here is to focus on the most vulnerable people or the most vulnerable or fragile of circumstances that affect global health. So, and the idea there is that by focusing on the most vulnerable, what you actually do is you create, hopefully your effectiveness-oriented interventions are effective. You create the opportunity for systemic change by recognizing in principle that those who are marginalized are outside of an existing system. And so your intervention seeks to bring them in a way that is fair and just, and that respects the dignity of each and every person and or the dignity of whatever system we're talking about. And then the final principle is excellence, which is that there are no double standards. right? There's no standard for the North and a standard for the South, the global North and the global South. There's no science for this group of people that, well, this group of people, we'll see. Right? In other words, double standard. This is not how you achieve a more fair, a more just, and a more equitable global society. And nor is it how you most effectively address challenges of the global commons, and specifically those relevant to global health. So the goal, critical problem solving, with a focus on three principles: effectiveness, equity, and excellence. This is the basic kind of thrust of the Institute. And then we have three themes, which you're all very familiar with now after having spent your time here as interns. And those are global health and humanitarianism, planetary health, and global health foresight. And we're going to hear examples of each of those today over the course of the symposium. Now, the students that you, as interns, have done many things in your work, and again, we're only highlighting 8 for all kinds of logistical reasons. If we could, highlight them all, we would, but we're doing 8. But just for example, people have done literature reviews, they've done data synthesis. You know what I'm saying? Data synthesis. Wow. Cataloging, content development, stakeholder engagement, and much more. And many people have learned really important research administration skills, which are really vital to good research. You can't do good research unless you have a good administrative apparatus. And I think the thing that's most important that people have learned, and which I have observed and I can see in quality of the work, is a commitment to a systematic methodological approach to whatever it is you're doing. This is also a core element of anything that is so-called academic. It is to be systematic. It is to be rigorous. It is to be replicable. In other words, whatever you do, if it is truly an experiment and or designed under the conceptual framework that I outlined previously of science, it by definition should be replicable. In other words, somebody else should be able to do the same thing that you've tried to do, and in principle, and within certain margins of error, that they should be able to reproduce the same results that you have produced. That's good method. That's good science. And whether that's natural science or social science, that is the nature of the very thing that we are trying to do. It has really important implications for policy and for practice. And that has been very much our approach. And one of the things that I also want to say that's quite important is that we're all on our journey, our life journey, and especially for interns, you're starting, and you're starting a career, and you're also exploring and constantly learning and adapting and changing, and your understanding of your place in the world and in this particular discipline, let's call it. And it's quite important that especially when you're starting, that you learn rigorously, and you focus on acquiring the practices, the behaviors, the mindsets of particular principles. And I have to say, when I'm just in having reviewed very quickly some of the slides, and also having talked with many of you over the year, it's such a pleasure to see people actually learn and actually go from here to here. And the only way you go from here to here is by setting the appropriate goals, setting the appropriate standards. And if you're here and you say, well, I'll just kind of do this, you will never get it. it is hard, as you know. It takes time, it takes mind, it takes effort, it takes getting over anxiety, it takes being vulnerable, it means talking to your professors and saying, look, I really don't actually understand. Can you help me understand? Which takes a lot of courage, right, to admit, I don't know. I really don't know, but I want to know. This takes, this is a process, and this is a journey. It doesn't end today. It's a lifetime journey. And Doctor will tell you the same thing. It never gets better. Right? But what gets better is your comfort, right? And your self-confidence that you can do this, right? And that you can go forward, and that you can make a truly meaningful contribution. I'm just thrilled again in having looked at the range of what we're going to discuss today. So let's get to that. This is a 2-hour event. I've lived it on now for quite some time. But we're going to start with the first 4 presentations, and each person is going to present about 5 minutes. And please try to limit yourself to 5 minutes, and then we'll have a 10-minute question and answer or so, and then we'll take a small break, and we'll come back for the remaining 4 presentations, and we'll follow the same process. We'll have a Q&A, and then we're going to wrap up by 1 o'clock. So, and for those who are joining us virtually, just remember, keep your microphone muted, and please use the chat function, which Natalie is monitoring, and she'll signal to me if there's something that she thinks is a priority, and that needs to be sort of brought into the conversation. And then also, if you wish to ask a question, whatever, just use the raise your hand function, which is at the bottom of your screen. So with that, let's start with the first 4 presentations. And our first presentation is by Anne Kwarteng. And Anne is working with Professor Kheradmand, one of our most stellar and impressive professors here at York and at the School of Global Health. In fact, it's a Canada Research Chair in Global Health and Humanitarianism. And Anne is working with Godfrey in the Global Environmental Health Research Lab. And the title of her presentation is Intergenerational Beliefs of Policing and Mental Health, and its implications for mental health care among Black youth. So with that, over to you, Anne.
Sorry, am I doing it wrong? Try again? Okay, got it. All right.
So nice and loud. It will project very loudly for the microphone.
Perfect. All right, good morning, everyone. I'd like to start off by thanking the Dahdaleh Institute for Global Health Research for helping fund this project, as well as my supervisor, Dr. Kwarteng. So this is what I will be talking about for this presentation today. All right, so to start, as we can see from these statistics, there are disparities in mental health within Black communities in both Canada and the US. So this is highly problematic, as also Black individuals in Canada and the US have lower rates of mental health service utilization. Now, interestingly, policing has been associated with this lower rate of mental health service utilization for 2 reasons. So number 1 being that Black communities in both Canada and the US have had negative experiences with policing, which has been associated with medical mistrust. And medical mistrust decreases likelihood of using health services. And also, second being that for many Black individuals, their first encounters with mental health services is through the criminal justice system. All right, so I decided to do my study on this issue as there's a gap in the literature examining both intergenerational beliefs for policing and mental health, and seeing its influence on mental health service use. Now, studies that have looked at either or, intergenerational beliefs for policing or mental health, have been done in the US among mostly African American populations. So I decided to do this study in the context of Canada, in the Greater Toronto area with Black youth. All right, so we had 14 interviews and 1 group discussion for our data collection. Most of our participants were recruited through our 2 community partners, Gashanti Unity and Ghana Union, as the study is a community-based action participatory research. So for data analysis, I followed the 6 steps of reflexive thematic analysis, with the 6 steps still being in progress. So now onto the results, which we can see through this thematic map. However, due to time, we will only be looking at 2. The first being over here, enacted mastery experiences of negative encounters with the criminal justice system, and second being verbal persuasion of intergenerational community beliefs. So over here, we have 2 narratives depicting the 2 sub-themes: unnecessary targeting from the police and lack of aid when in need. Now, I'd like to direct our attention to the last narrative over here, where the participant talks about an extremely negative experience with the police, where after getting stabbed, he experienced very delayed help from them. So over here, we have the 2 sub-themes for verbal persuasion, beliefs about mental health, and beliefs about police. Now, I like to direct our attention to the first the first narrative over here, where the participant talks about how in their Caribbean, Jamaican background, that mental health is not something talked about and is stigmatized as well. Now over here, we have 2 narratives for the last sub-theme, intergenerational mental health coping mechanisms. And I like to direct our attention to the first one over here, which kind of ties in both intergenerational beliefs about mental health and beliefs about the police. Now, these participants, which were in a focus group of 5 people, have had negative experiences with the police, are mostly Caribbean Jamaican, where mental health is stigmatized, and they also come from a community where there is a negative intergenerational belief about the police. So when the interviewer asked them, would they access mental health services, we can see that 4 out of 5 of them explicitly stated they would not. So over here, we can see again the influence of these beliefs and negative encounters, where an overwhelming amount of our participants have not used mental health services. All right, so for future work and policy implications, it's important for us to increase culturally relevant resources, as this was highlighted by many of our participants that they didn't feel that therapists would be able to relate to their real life experiences. So now onto my reflection over this 4-month process. So I learned the importance of community-based research, as many of these narratives wouldn't have come out without the help of our community partners. So my next steps are to publish a paper on this study, continue my research with Dr. Kwarteng as well. And finally, I'd like to acknowledge all these people on this slide, as well as the organizations for making this research possible. Thank you.
That was great, and thank you. And I have tons of comments, tons of questions, but I will let them go for now.
Good.
I will say though, you have to publish that. That is fantastic. Our next speaker is Pashtana. Pashtana Fakhrizada. Okay. Pashtana is working with Professor Kheradmand, who is another really outstanding professor here at York, Global Health, expertise in complexity theory and in modeling different types of complexity, which include social science-based understandings of the nature of social change and the nature of policy change as it affects health. And Pashtana has been working with her to support research and activities on the IDRC-funded Equitable Global Health Research Project. And the title of Pashtana's presentation today is Equitable Global Health Research, and she's going to talk about the Ray internship. Over to you.
So, hello everyone.
Nice and loud.
Pashtana,
Very
and
good.
I'm a global health student and I'm here. First and foremost, I would like to thank the Dahdaleh Institute and the symposium organizers, as well as my supervisors for granting me this opportunity. And today I'll be sharing my insights from my work on the Equitable Global Health Research Project over this. So the Equitable Global Health Research Project's primary aim is to examine how power dynamics and equitable partnerships, as well as benefit sharing, have evolved in global health research, as well as understanding how these elements play a role in shaping equity in global health research. As the field grows, it's crucial that we foster relationships and practices that are mutually beneficial for all stakeholders, especially those in the global south. The motivation behind this research is rooted in the need to address health disparities that arise from north-south power dynamics, including the roles of funders, publication, and institutional practices. And this has often led to inequitable outcomes in global health research. By examining the shifts in the roles of funders, journals, and institutions, we can better understand how to promote equity in this field. And ultimately, our goal is to mobilize practices that ensure a more balanced and just approach to global health research. To achieve this, we're engaging the global health community, which include universities, researchers, policymakers, and funders. And we're also employing systems thinking methods such as network analysis, group model building, surveys, interviews, and design thinking workshops. So now I'd like to share some of the specific tasks I've been involved in. First being the network analysis. So the network analysis provides quantitative data regarding the roles of journals, funders, and research institutions in global health research. And I played a role in cleaning and organizing data for network analysis. This also involved ensuring that the data set was complete and accurate by identifying and handling any missing values. And the second component were the key informant interviews, where I created a participant database that involved collecting and organizing contact information for potential survey and interview participants. This database will be a vital resource for the ongoing research, which enables us to reach out to a diverse group of stakeholders in the global health field. So as you can see, the figure on the left shows the structure of a network where we are interested in how research institutions, journals, and funders are connected by research across both the global north and the global south. The circles representing institutions and the square representing funders, the triangle representing journals, and the color variations show the global north and the global south. Some of the skills I learned from my role include database design and management. So I learned how to design and manage a database effectively and ensure that all information and participant information in this case was organized and easily accessible. Developing a participant database also enhanced my skills in organizing and managing large sets of information systematically. And I also gained experience in collecting and curating data. From the network analysis, working with the network analysis required meticulousness in data handling, and every small detail could significantly impact the accuracy of the analysis. I learned the importance and the methods of data cleaning that ensures our analysis was based on high quality and reliable information, as well as analytical thinking and problem solving. So the process of organizing and analyzing data sets honed my ability to think critically and solve problems as they arose. And all of these experiences not only enhanced my technical skills, but it also deepened my understanding and appreciation of the research process itself. So what's next? Looking ahead, I plan to continue with an independent study where I will be supporting a scoping review regarding gut health and NCD prevention. And I will also be doing my practicum placement over the winter and doing my global health BA. From there, I'm interested in applying to graduate programs, hopefully, where I'll be furthering my education and specializing in global health research. And lastly, I would like to express my gratitude to my supervisor, Dr. Kwarteng, as well as the Dahdaleh Institute for supporting this. For more information about the Equitable Global Health Research Project, you can visit our website.
Well, again, lots of questions. But my very first impression is you really grasp the essence of methodological rigor in research. And that's particularly challenging in the domain that you are working in with Tara. Tara is very much at the forefront of defining methodologies with great rigor so that we can be confident in the results. And what's clear to me is you get that in the way that you presented here. And it's also, I hope you really are seriously pursuing your research. I got that feeling you'd be really good at it. So thank you for that. Our next presenter is Shreya Pandrala. And Shreya is working with Harvey in news and narratives. And Harvey is a professor emeritus now here at York. He was the dean of the Dahdaleh School of Public Health at University of Toronto, and really set in motion major changes and the kind of important research administration structures that have led to the Dahdaleh School becoming really, really a significant school in terms of global health, public health, and global health. And then he came to York and was the founding dean of the school, of the health faculty. And so he set that up. And that takes real vision, real commitment, and he's done it incredibly successfully over a 12-year period. Now he's professor emeritus, and he and Susan, both his partner and colleague, professional teaching, they're very much focused on health and wellness. And they have a lab here at the Institute, the Health and Wellness Lab, or the Wellness Impact Lab. Shreya has been a part of that, and she's been supporting various projects and activities. And the title of her presentation today is The Impact of Gong on Wellness. So Shreya, over to you.
Hello everyone.
Thanks a lot. I can hardly hear you down here.
All right, so my name is Shreya, and I'm a research assistant at the Wellness Impact Lab, as Dr. Rosa said. And I would first like to thank my supervisors, Harvey and Susan, and the Institute and its event organizers for providing me with this opportunity to talk about this. So currently, I'm working on a literature review on the impact of Qigong and Tai Chi, which are forms of traditional Chinese medicine, on wellness. The idea for the paper first arose after the lab initiated the Integrated Wellness series, where Harvey and Susan provide 30-minute online sessions of Qigong, Qigong as in Tai Chi forms, and also mindfulness meditation twice a week. So the aim of the literature review is to address the notion that traditional wellness lacks what the West has as scientific evidence, right? So my specific role in this project was to publish research about the values and the cautions of using Qigong and Tai Chi, and then write a literature review of some of my findings. So some of the work I did to facilitate the development of this project is create a few research streams, writing an added to the bibliography, and a short synopsis of my findings. For my methods section to find peer-reviewed journal articles on this topic, I searched the PubMed and Google Scholar. And I limited the range of years from 2010 to present, but there was a specific focus on research published within the last 5 years. Key information that we ascertained from systematic reviews, as well as empirical studies, show that regular Qigong practice sessions actually alleviate mental health issues, such as anxiety, depression, and insomnia. Particularly for postmenopausal women or women who have experienced intimate partner violence, Qigong has shown a positive effect on them, and it also has the potential to reduce the severity of their insomnia. Furthermore, research also shows that Tai Chi has a positive influence on the elderly, as it can decrease their fall risk and stop them from injuring themselves. So, through this opportunity as a research assistant, I have learned a great deal about the significance of Eastern medicine, and that's allowed me to remove some conceptions that I previously held about complementary therapies or traditional medicine as opposed to Western medicine. In fact, I am excited about the implications that Qigong and Tai Chi will be effective therapeutic interventions for range of health and wellness issues. And I believe the research findings, which show that Qigong and Tai Chi can be used to facilitate both psychological and physiological rehabilitation to be extremely relevant. So I hope that we can take these results and we can study how we can learn how to integrate traditional medicine to Western medicine in a way that promotes mental health. Lastly, something that stood out to me during my experience here at the Dahdaleh Institute is how community involvement fosters mental health related activism and environmental activism, particularly as a lab also runs climate cafes, where we invite students to talk about the feelings related to climate anxiety and climate change. So I've learned a lot about the environment and also the mental health through my experience as a research assistant. So some of my next steps for the future include investigating how we can create more collective conversations about topics such as mental health, and how we can approach it in a way that doesn't antagonize anybody, that is not judgmental, that is open-minded, and how we can address those underlying problems that create stigma around mental health or create apathy for the environment. On a more personal level, I plan to graduate by hopefully by June 2025 and then apply to CRPO accredited master's programs so that I could become a psychotherapist. As for the paper itself, we haven't decided yet whether we're going to publish it on the Wellness and Mental website or if we're going to publish it in the journal. And it's not completed just yet, but I hope to do that by the fall. Finally, I'd like to thank Arabi, Susan, and Amy, who are the other research assistant at the Wellness Impact Lab, and just everybody at the Wellness Impact Lab for the contributions that they've made to my profession. So I hope you all enjoyed this presentation, and thank you so much for this.
That's wonderful. That's wonderful. Yeah, again, this first reaction, again, it seems you've learned the core skills of research, which is to survey, do it systematically, formulate, and then describe, which is what we've done. And that's fantastic. And the other thing that I would just say is that it's very clear that at least to me, as a, I guess now a young elder, I suppose, and then to younger professionals, like Godfred and others, there's a major change happening in the world now around health and our understanding of health and the symbiosis. I don't want to say integration, because in some cases that is not true. In some cases it is, but the symbiosis between Eastern and Western perspectives and practices, and what you described around the activity of Tai Chi and Gong in the impact, the Wellness Impact Lab. This is really not only kind of therapeutically meaningful for those who engage it, and there are many now who are using the lab, and many beyond the lab who are beyond York using the lab. Not only impactful therapeutically, which it certainly is, but the research that is now taking place at the lab is really important research. And I strongly urge you not simply to post it on the website, but you got to publish it, and we can post that website. you'll have a much broader reach and much broader impact in terms of sharing with what is evidently excellent research and knowledge. So thanks for that, Shreya. Our fourth presenter is Rosa, and Laura is working with Dr. Mathieu Portier, who again is another one of our really outstanding professors, whose expertise, whose methodological expertise is in equity and how to understand, define, operationalize, and measure equity in different settings and in different regions of the world across different aspects of healthcare. It's a very complex methodological understanding. And Mathieu is really one of the intellectual leaders in this area. And Laura is working with Mathieu to support the research projects and activities that are taking place at the Global Strategy Lab. And the title of Laura's presentation today is Integrating Gender in Tobacco Control. So Laura, over to you.
Thank you, James. So hi, everyone. My name is Laura. I'm a fourth-year global health student here at York University. And this summer, I've had the pleasure of working as the Global Legal Epidemiology Research Assistant, quite a mouthful, I know, under the supervision of Dr. Mathieu Portier at the Global Strategy Lab. If anyone is not familiar with the Global Strategy Lab, we're located just one door over. If you walk past the kitchen, you can come visit us, or you can come visit the website. But to sort of describe what it is, I would say it serves as a research hub composed of an interdisciplinary team that's working to address a variety of global health challenges. And most of the work that's conducted in the lab falls under one of three thematic areas, one of them being global legal epidemiology, which is the area that I'm working on. And to sort of just give a brief overview of what global legal epidemiology means, it's just basically the study of how international law influences the distribution of health and sort of shapes health outcomes in countries all over the world. And a big focus of the global legal epidemiology team at the lab has been tobacco control, and specifically looking at the impact of the Framework Convention on Tobacco Control, so FCTC for short, the impact that legislation has had on the global fight against tobacco. So that really leads into my work. There have been two tasks that I've been working on this summer. One more minor one was assisting with the literature review on the gender differences in smoking intensity, and that was just sort of a side project that I worked on for a study that's still ongoing and in its final stages. But the real bigger project, the sort of main task that I've been involved in, is a commentary on the integration of gender in tobacco control research, specifically research related to the FCTC. We found that the FCTC takes a very gender-blind approach. It's not very gender responsive at all. And the FCTC Secretariat ended up releasing a follow-up report in 2018 to address this issue. But for our study, or for the commentary, we wanted to look at research that's been published that addresses the FCTC and gender. So I've looked at all the studies that fall under that, and now I'm trying to assess the extent to which each of the studies is integrating gender in research. And the way I've been assessing that is by applying criteria from the Gender Impact Assessment Framework, which you see here on the right, that's been developed by the European Institute Gender Equality. And that's sort of the bulk of my work. I've just finished the data synthesis part of the project, and now we're working on drafting a manuscript, which is really exciting, and I hope that will get published sometime soon. But it's been a busy summer, but also a very rewarding experience overall, and many lessons have been learned. One of them being that the research takes time. It requires some flexibility, and obviously requires collaboration from different disciplines. And that hasn't necessarily applied to my project. I'm working with the smaller team, but it's just something that I've witnessed by being part of the lab. And here at the DI, obviously there's people from backgrounds working together, which is just great to see. Another big lesson that just sort of came from my research specifically is that controlling for sex and gender in research is not as helpful as it may seem, and it can actually obscure important trends in the data, which will then make it difficult for us to develop tailored interventions for equity observing groups, in this case women. And that could sort of inadvertently contribute to gender inequalities and keep health inequities alive, which is not what we want to do. But on a more lighthearted note, I also learned that being involved is really important, and I've appreciated everything that the Global Strategy Lab has been putting on and inviting students to, and even at the DI, there's always events and activities to be involved in that have been outside of our projects, and also just appreciated being involved in projects outside of work. And I think this summer specifically, I've been doing sort of maintaining a work-life balance as a student, and just seeing what's out there besides the work that I do here. But I obviously very appreciative of the work that I do here. And lastly, for future plans, I'm excited to announce that I will be staying on as a research assistant on the GLE team. So hopefully you'll see me present again next spring, and I'll talk more about this research and some other research that I might be doing. I'll also be applying to postgraduate programs later this year and up until early next year. And that's because I'll be graduating from the Global Health Program in June of 2025. So that's really exciting, and I look forward to see what the future has in store for me. And before I wrap up, I just wanted to say a big thank you, obviously, to Teresa and to Natalie for putting this on, and to James, and for all the opportunities that we've had here at the DI, and also a big thank you to the Global Strategy Lab. Everyone, the whole team is just so great, and you've made my experience a very pleasant one. And a big thank you to the Dr. Kwarteng for being an awesome supervisor, and to Gina, who I've worked really closely with, who's been an amazing mentor. So thank you overall. Hope I didn't talk too fast. I know there's a lot of information to go through, but yeah, I hope you enjoyed.
You packed it in there. You covered it all. One thing that strikes me, and perhaps I'll ask you a question about it, but one thing that strikes me is that the Framework Convention on Tobacco Control came out of a growing normative understanding that the use of tobacco is not a good thing when it's used in the way that has come to be used. Without going into the whole history of that, what was clear in the 50s and early 60s, normatively, in other words, when we say normatively, we mean by popular consensus and by general public view. That's essentially what the word normative is. It was understood normatively that tobacco use is not good, and that it causes bad health, and that it also not only morbidity, but very, very significant mortality. It was only when science and a rigorous approach to understanding the physiology, the pathophysiology, patho meaning disease, the pathophysiology of the impact of tobacco smoke on human health, and also the science of social dynamics, of the way in which human beings behave, both individually but also collectively, and also organizationally. So organizationally would mean government, the private sector, in other words, the tobacco industry, actually understanding and applying a method, a scientific method to understand how the pathophysiology works, and also how the social dynamics around use, control, promotion, whatever, of tobacco, how that actually works. It's only when there was a rigorous approach that the Framework Convention on Tobacco Control emerged. And it emerged not by sort of an aha moment where everybody said, oh, no, well, this is obvious. It emerged over a long period of time which involved many, many scientists, many activists to gradually change the approach of the world to tobacco control. And I want to ask you, Laura, given your focus on gender sensitivity, and I guess what I would summarize as saying the lack of gender sensitivity in the Framework Convention, how do you see that process? How do you see, for example, bringing science to bear and the work that you're doing in legal epidemiology to bring science to bear on that question? How do you see the process of change? Do you think that this work that you're doing will contribute to a better, more nuanced understanding of gender and the health impacts of tobacco use under the framework.
The question. I think it will. I hope it will. Obviously, we're working on it's more so a commentary, but I still think that commentary will bring sort of attention to the fact that there aren't that many studies that do gender analysis of tobacco control. And even if there is gender disaggregated data available, not a lot of researchers are taking into account what is the gender impact. So what interventions could we be putting in place to protect all different genders from interference from the tobacco industry. But there are some studies out there that do talk about it, and I think people are starting to bring the science to it. But gender smoking is not just a masculine problem. Yes, the prevalence of smoking is higher among men in most countries, but women still smoke. And maybe in the data it may seem like it's not as important, but maybe we should be thinking more critically about, is there something missing from the data? Are women perhaps not reporting that they're smoking because it may not be seen as socially acceptable, or maybe they're smoking less when they're smoking with women who are smoking more intensely, or they're using other types of devices. It's not just smoking. So there is more science sort of coming out of there, and I think the FCTC has done a good job of addressing it in their technical document that they released. But it's just there's a lack of pushing countries to actually address it, collect and report to the FCTC Secretariat the gender disaggregated data, and then develop interventions for that. So I hope that the work that we're doing now, and that I think we'll be doing fall and winter, will bring more attention to that. Researchers and policymakers will see that that is to address that smoking is not just a men's problem, and that preventions may have impacts.
And there are, so that's a great answer, terrific. There are also, just to comment on it, there are very gender-specific impacts of smoking. And so just, I think the most obvious one that most people know about is that in women who smoke, they have a higher degree of miscarriage, higher rate of miscarriage. They also have a higher rate of their intrauterine growth retardation, even when they're pregnant. And there are many other dimensions that are specific, health impacts that are specific to women. And so it's great work, and I wish you the best for it. And also listening to your own goals and your own reflection on just having a little space in the summer to reflect a little bit and to kind of position in your own mind your work and your personal life and how these things interdigitate. That's wonderful. I'm so glad to hear that. I really encourage people to do that and to make sure that you and you can talk to people, talk to your professors, talk to the grad students, talk to the postdocs. I mean, these are people who have experience in these very important matters. But get their advice. How do you approach this? How do you deal with different things? How do you deal with uncertainty? And research is so vague, or at least it seems vague. That's actually not vague. How do you deal with that? And so I really applaud you for doing that at this summit. I have a question for Anne. I really enjoyed your presentation.
Thank you.
And I just would like to ask you about the relationship between medical mistrust, so among Black people, and most especially among Black youth, their mistrust of medical professionals, medicine, and its relationship to trust of police. And what is the similarity? Is there a similarity in that, in terms of causality of why Black youth mistrust on both fronts?
So there's actually a study that I used in my literature review that came out in 2021. And what they found is that because we see both institutions as institutions that are supposed to help us, so that when one doesn't help you, and especially for the fact that the first way we get into the healthcare system is sometimes through the police, right? Through calling 911. So when you don't get that help from, say, the police, right, who are kind of like going to bring you into that healthcare system, then you're not really gonna have trust in the healthcare system as well. So that's where it kind of ties in, because for sometimes for a lot of people, the police are their first step into that healthcare system. So they found that there was actually like kind of a statistical association between that. So specifically, the paper found that people who had negative encounters with the police had greater odds of unmet mental health care needs. So it's definitely an association that's still being realized, especially because this is not I think because we've had big studies like a 2007 one that had like a huge sample size, looking at mental health and like lower service mental health utilization. We haven't seen too many studies really looking at that. And then studies also looking at why is this happening? Why are Black youth having lower rates of mental health service utilization? So it's kind
Great answer, really good answer. There was one, I would also just, as a sort of a general comment I'd like to make. The research is, the more precise it is, typically we think the better it is. But it's always important to situate that particular precision in a broader context. And so research, for example, doesn't happen in a vacuum. It's not ahistorical. It's not like there's no history. And that's we're just discovering reality. Reality is shaped by history. And so the current structures that we're in, our current beliefs, the way we think about a particular problem, these are deeply shaped by history. And one of the things, as you were speaking, I was thinking, yeah, I remember excuse me, and I know God will be familiar with this, with the Tuskegee trials back in the 1930s. Does anybody know about that? Yeah. So for those who don't, I'll just mention it. I think it was 1932, somewhere around there, the American Public Health Agency conducted an experiment, and they called it a natural experiment. And what they did was they identified 400 Black men in the United States who had syphilis. And there was a treatment for syphilis at that time. But the public health agency, excuse me, decided, well, we're going to do an experiment. And it's a natural experiment, which means that we're going to identify these people. We're going to chronicle their signs and symptoms, in other words, the progress of syphilis, and we're not going to do anything. We're not going to treat. And we're not going to tell them that we're doing this or that we're monitoring. So they had these men come to clinics and they took all kinds of samples on a regular basis and they examined them and so on. They chronicled the impact of syphilis. I won't go through the medical dimension of that, but there's three kind of three kind of sequential degrees of severity. And you just get worse and worse and worse, and eventually you die. And it's extremely painful death. It's not easy. And I've seen it many times. It's really not a good death. Of these 400 men, 100 died of syphilis. And this was secret. Nobody knew this was happening. And then over some time, through activists and other scientific activists and largely Black scientists, it became revealed that this is what the Public Health Agency of the United States had done. And that essentially was one of the core moments for the Black community in the United States and in much of the Western world, where they just thought, we just can't trust these people. We cannot trust authority. We cannot trust even doctors who made that choice because of an inherent structural racism that was just so embedded in the way things were done. Now that memory, it has, I won't say dissipated, but it has influenced, shaped, and become part of the consciousness. And whether young people know that specific story or not, it's that story has influenced how they see medical professionals, public health officials, and so on. And there is, based on that and many other things, and some of the things you talked about, there is this inherent stress. And the only way we can overcome that is by illuminating and by exposing and understanding and then remedying, not only on the side of Black youth, but on the side of medicine, right? And within medicine, there have been enormous changes, but still not enough. But those changes only occur through illumination, which is based on rigorous research. So again, I congratulate you on what you're doing, and just keep going. Yeah, it's excellent. Pashtana, I want to ask you, maybe if you just want to comment a little bit on methodology, like you talk a lot about data cleaning, excuse me, and understanding how important that is. Do you want to just talk a little bit about that?
I think it was really interesting kind of being involved in the process that this specific project has inequity and global health is something that we always thought about. But to kind of be able to measure that and provide a quantitative data evidence regarding the relationships and the roles that different global health actors have had and published global health research. It was really interesting, the network analysis being that. And a lot of the project is very much still in the works. So yeah, the network analysis essentially is being done on a data extraction from peer-reviewed published literature over the past, I believe, 10 years. And yeah, so based off of the results from that network analysis, we were able to see the roles of different global health actors that will be coming from the results of that analysis that will be that's still in the works and will be.
Good. So data cleaning, what does that mean?
So in our case, it was we're working with a data set that was an extraction from Scaffolds, and it had a lot of it was like extracted in the way that we kind of work with, and we needed to make a lot of changes to it in order to make sure that the variables that we are looking for are correctly identified, and that the results that we will be getting will also be accurate and will be obtained from information that is exactly what we are looking for. If there is outliers or things that have just been identified with like systematic error. So.
Great. So the question then that I would just add into the final question is what's the impact of clean data versus dirty data, let's call it, on your analysis?
Yeah, so to kind of give an example, a part of the data cleaning was kind of making sure that from the literature review, we're identifying the primary institute affiliation, and to put in perspective, clean versus dirty data, having the clean data that that we've overlooked and we've gone through multiple times will allow us to know the actual institutes that were affiliated with the published research and the researchers that were involved, as opposed to different ways that it may have been listed or the variations that may have been listed across the multiple journals, the different sort of publications that were.
Good. And it just means then that your results are reliable and others can depend on the results. And that's, you talked about the TV and little bit. Somebody did it. I thought, wow, research takes time. It does. It really does. But the impact, if you do it well, and if you pay attention to the details, which is clearly what you're really good at, the results are highly, highly reliable, and can be really, really impactful, and can really help change a situation that needs to be remedied. So thanks for that. And then, excuse me. I think I asked Anne a question. Shreya, did I ask you a question? No, okay. So tell me, what's your, when you talk about your interest in psychotherapy, how do you see that in relationship to what you're learning with the wellness stuff?
When I say I want to become a psychotherapist, I do want to work in the counseling setting, right? And as you said, like one of the bigger conversations that's emerging right now is like how we create this symbiosis between cultures. And there's so many alternative therapies like Reiki, Qigong, Tai Chi, mindfulness meditation, all of these things that or yoga that are from other countries, like Indian cultures, Japanese cultures, Chinese cultures, etc. And so, and you know, even just if I become a counselor in Toronto, like there's so many different people color who come from these cultures and who might have like lots of spiritual beliefs. And I don't want to like negate those spiritual beliefs just because it's not like it doesn't have like Western evidence, you know. So like if I were to become a counselor, I would try to find ways that I could like integrate spirituality into my sessions, especially if it's helpful for the people that I'm counseling. And sorry, what was your question?
No, you're answering it. How does your interest in psychotherapy relate to what you're learning at the lab?
Yeah, right. We also talk about climate anxiety a lot in the lab. Like with the way that climate change is evolving so rapidly, and we're seeing all of these like negative effects of it already, like rising sea levels and the wildfires in Alberta recently. Like people are having to move out of their homes, they're having to give up their lives. And there's just a lot of trauma that I think is going to emerge within the next couple of years where people are like climate refugees and or they've like lost a pet to fires or they lost their homes or they've just had to like relocate. And so when I'm, you know, doing therapy, like I expect that I will meet some people who have a lot of anxiety about the future and they don't maybe like they don't know if they want to have kids anymore because they don't know what the environment's going to be like in 20 years. So that's definitely something I've been thinking about when we were talking about climate anxiety in the lab. I was like, in the future, I'm going to get patients with climate anxiety. And how do I, you know, coach them through this? And how do I tell them that their feelings are valid? And how do I find ways to help them with that? That's something that's going to.
Fantastic. Well, I wish you the very best. It's a great answer. Godfrey, Alex, anyone else? Would you like one or two questions? Then we'll take a little break. Go ahead, Alex.
I have a question for Anne. I was really interested in what these culturally appropriate mental health resources might look like and whether would there be one that was fielded to say like multiple different Black communities or would it have to each of the specific communities?
Yeah, that's a great question. So what we did with that was that we used a diverse sample of different ethnic groups. So actually our community partner, Community, one of those people, Muna, we actually talked about how for specifically Somali people, because they there was a civil war there. So there's kind of a different level of trauma and mental health concerns regarding that. So, and then there's also been an unfortunate like incident of a lot of their sons being involved in kind of like gun violence and some of them losing their sons to that. So what she kind of suggested was in Somali culture, there's a cultural thing where women come together and cry together. So she kind of suggested just kind of having weekly meetings with the woman so that it's kind of like relating to their culture and it's not just the standard of
just meeting with the therapist. So that's kind of one of the culturally relevant resources that she was saying would be really helpful.
Thank you. It's very interesting.
Yeah, no worries.
Okay, well, thank you for fantastic presentations. Let's take a 5-minute break. I know it says 10, but we'll take 5. And just buy a break, grab coffee or whatever it is, have a nibble with some of the cookies. And we'll come back at 12, maybe at 11, at just after 12:15. So welcome back, everyone. We now have 4 more last presentations, and our first of the remaining 4 is by Lauratou Bah, and Lauratou is working with Stephen Hoffman and Arnie Ruckert, and also team, and she's working with Stephen and Arnie on antimicrobial resistance policy, and in what they call an AMR policy accelerator. I'll just note that Stephen Hoffman, I don't know Arnie very well, but I know Stephen, and Stephen is at the really at cutting edge of defining legal epidemiology and as it applies to health. And there's also now he's been seconded to the Wellcome Trust, big foundation focused on global health, and he's there as one of their senior policy people, but still has maintained about 20% of his time focused on supporting the ongoing research that he is supervising around antimicrobial resistance. And so, excuse me, Lauratou is going to talk about her work in the AMR Policy Accelerator. And the title of her presentation today is Knowledge Translation and Acceleration as a Determinant of Health. And Lauratou is online and will be doing her presentation virtually. So over to you, Lauratou. Welcome.
Thank you. Thank you very much. I appreciate the welcome. I guess I'm going to get started then. So good morning, or sorry, good afternoon, everyone. Thank you for being here today. My name is Lauratou Bah. I did work at the Global Strategy Lab in supervision with Professor Stephen Hoffman. I want to say a special thanks again to the Operation and Communications team, specifically Sophia, Latika, and Demetria. So in our topic overview, we're going to explore the vital yet often unappreciated aspect of public health, which is the power of knowledge translation and mobilization. So in our rapidly changing field, groundbreaking research alone isn't enough. We must ensure that the insights that we gain are effectively translated into practical applications to improve health outcomes for audiences and stakeholders outside of the realm of academia. I worked with the most brilliant minds in GSL, and often their work doesn't translate well for the public, especially when it comes to AMR research, because again, they use a scientific method. So imagine navigating a healthcare system where the language is spoken is foreign to you, the terminology is complex, and critical health information is out of reach. So for many, this is daily reality. So in definition of knowledge translation, it's the process of making research finding accessible and understandable for non-experts. So it ensures that valuable knowledge is applied in real-world settings. So knowledge mobilization involves actively disseminating the research to those who can benefit from it. So this does include healthcare professionals and policymakers and the public. So these two terms are often interchangeable, but there are some like little differences, mainly that KT is about translating research, whereas KMB is about ensuring that the knowledge is presented in ways that can be easily presented in like social media, for example. So it can lead to tangible health improvements. Next slide. So the role of researchers and healthcare professionals. So as researchers and healthcare professionals, it's our primary tasks to generate insights through the scientific method, but we have to keep in mind, why should the audience care? Keeping like are they also researchers and scientists? What information can switch the light bulb for stakeholders so that they can see how the research in a less complicated form can be engaged with the public. So whether this is through briefs, reports, infographics, videos, it just means that it's not confined, knowledge is no longer confined to just academic journals, that it can benefit society. Because not everyone is an expert, but everyone can use knowledge to leverage health outcomes. So enhancing social determinants of health. So I believe that knowledge translation and mobilization bridges the gap, especially when we're talking about social determinants of health. You can go to the next slide, please. So I found that 3 social determinants of health specifically are more related. So education and health literacy. So by simplifying complex research into accessible formats like infographics and videos, we can improve public understanding across diverse populations, regardless of their educational background, which increases range, social and community context. So strengthening community networks with the knowledge that they need to advocate for better health policies for themselves individually and as well as communities. So it ensures that the KT products help reduce disparities and gain more involvement outside of the healthcare system, which is a concept that we know as One Health. So healthcare and education, or sorry, healthcare and health and healthcare. So through knowledge translation, we can promote health equality by shaping policies that address the needs for underserved populations, particularly in the fight against antimicrobial resistance, because that again requires rigorous scientific methods in order to gain the knowledge in the process of knowledge creation. But again, it doesn't always translate. Next slide. So I have some visual examples here. I also have a quote. So knowledge mobilization ensures that research doesn't just stay within the academic circles, but reaches those who can use it to create solutions in society's most pressing problems. So as you can see, in the Global Strategy Lab with the communications team, we do a lot of promotions for social media. So this includes like newsletters, diagrams, like postings for slides specifically for LinkedIn and Twitter, as well as for, of course, email. So one of the projects that I worked on was briefings for the Montreal Protocol. So it offers valuable lessons for improving global governments, but it is quite a lengthy report. So within my internship, we did a lot of editing, speaking with the stakeholders, speaking with the writers of the brief, making sure that our audience is able to really digest the information that they gain from it in colorful ways. So this also includes like future planning. So that would mean like webinars and presentations that come from the content that is made. So in conclusion, I urge all of you, whether you're a researcher, a healthcare professional, or a policymaker, to make knowledge translation and mobilization an integral part of your work. So this is not just about sharing knowledge, it's about transforming lives to ensure everyone, regardless of their background or level of health literacy, can benefit from the advances that we make in public health and public health research. For me specifically, I think you can go to the next slide as well. Oh yeah, that was just the outcomes that I was sharing about. Yeah, so I think that's the next slide is good. So in my internship, I learned quite a lot, especially with my interest in health promotion, like in the media. So learning about how to make infographics, what questions to ask specific stakeholders, and just continuously going back and forth so that we can gain independence. Gain the importance from the content. So I'll be graduating in the fall. I'm continuing my education in healthcare, specifically in art therapy and health and safety. But I enjoy speaking and presenting. So I will be looking forward to doing more global health panels, even coming back to the Global Strategy Lab for that, or your university in general, and presentations. So in the end, the true measure of our work lies not in the research we produce, but its ability to reach and improve the lives of those who need it most. So let's commit to bridging the gap between knowledge and action, ensuring that our efforts in public health lead to meaningful and lasting impacts. Thank you.
That was great, Lauratou. Thank you. I'm not going to comment just because of time. I've been told to quieten myself, which I'm trying to do. But I will ask you a question later on. Our next presenter is Arabi Rajan, who will also be presenting virtually. And Arabi is working also with Tara Committee, and she's working with Tara to assist with the global food system and policy research team. And the title of Arabi's presentation today is Antimicrobial Resistance and Food Systems. So over to you, Arabi.
Thank you very much. So hello, everyone. My name is Arabi Rajan, and I currently work under Dr. Penny and Dr. Asbury alongside the Global Food System and Policy Research team. First and foremost, I'd like to extend my thanks to the DI Institute, the symposium organizers, my supervisors, and the GFS PR team. I'm deeply grateful for the opportunity and the support throughout this internship and for being able to present my work today. I had the privilege to work on the AMR project and the AI NCD prevention policy project that looked at AI methods and NCD prevention policy. But today I'll be focusing on my work on the AMR project that looked at antimicrobial resistance and its connections to the food system. So before we delve into the specifics of the project and my contributions, I'd like to provide some background about AMR. Antimicrobials play a crucial role in preventing and treating infections across humans, animals, and plants. However, microorganisms can develop genetic alterations over time that render these drugs ineffective. So in our project, we looked at AMR and its relations to food systems. The use of antimicrobials is significantly higher in animals than in humans and creates a substantial risk to human health, as resistant bacteria can transfer through improper food handling and contamination. The impact of AMR extends beyond human health, affecting food supplies and contributing to major issues like extreme poverty and malnutrition. So this is where One Health concept becomes extremely crucial, as One Health provides an integrated approach that addresses the interconnectedness of human, animal, and environmental health. So the primary objective of our project, called Designing AMR Solutions, is to strengthen antimicrobial stewardship at both national and global levels. A One Health approach was employed, and our project involves enhancing policies and governance structures through multi-level and multi-sectoral coordination. So the project has 5 case studies, which is highlighted on this map, and the research was organized into 5 key work packages of the slide. So my contributions to the AMR project began with my involvement as an independent study student in winter 2024. I conducted a systematic scoping review of peer-reviewed literature, gathering evidence of intersections between AMR and the food systems within the 5 countries, as well as reviewing their AMR national action plans and then identifying how the food system was considered in each of these plans. I presented my findings to the teams in a form of presentation and a final report. As a research assistant, I was tasked to develop a poster for the Geneva Health Forum that occurred in Geneva, Switzerland in May. I visually represented important findings of an umbrella review that identified evidence of associations between determinants of AMR that's situated within the food system. Additionally, I also participated in a system analyst workshop that examined the role of the Dutch system in the emergence and spread of AMR. I've helped develop a summary report of the workshop highlighting the proposed priority actions that were discussed. So throughout this internship, I've gained skills in conducting systematic scoping reviews, which has contributed to my understanding of how to gather, analyze, and summarize information using data charting forms and summary tables. I've also gained experience in knowledge transfer and dissemination by working and designing on the poster and presenting it to the team allowed me to convey complex information in an accessible manner. Another area of growth has been in system mapping. I've learned to visually represent and understand intricate systems through the maps that we use, which are called the loop diagrams. And also the internship has taught me to draft detailed reports and protocols, allowing me to structure information scientifically. So for what's next, as fall 2024 approaches, I look forward to completing my degree and to see the outcomes of the projects I've been involved with. I've also planned to apply to graduate programs and to continue pursuing ongoing research opportunities. So I appreciate all of you for your time and attention. If you'd like to know more information about our project, please visit the website on the slide. Thank you.
That's wonderful, Ravi. And I will also edit myself by not commenting now, but I will subsequently. Our third presenter is Noori. And Serina is here in person and will be presenting as such. She's working with Professor Tara Penny as well. And they're working together to assist with the Global Food Systems, Disease Prevention, and Surveillance Research Team that Tara leads. And the title of Serina's presentation today is Systems Informed Evaluation, Canada's Food and Nutrition Surveillance System. So over to you, Serina.
Good afternoon, everyone. My name is Serina Noori. I'm a research assistant with the Global Food System and Policy Research Team. And I'd like to begin by thanking the Dahdaleh Institute and my supervisors, Dr. Penny and Dr. Lee, for this opportunity. So today I'll be sharing my experience supporting the evaluation of Canada's food and nutrition surveillance system. So the monitoring of food systems is important to guide policy and action toward health, along with supporting sustainable and equitable food systems. However, achieving this requires the collaboration among various sectors and actors, which subsequently relies on a shared understanding of the food surveillance system, both of which require strengthening in Canada. To acknowledge this situation, the objective of this research project entails a systems-informed evaluation of the current food and nutrition surveillance system to shape a shared understanding, identify areas for improvement, and to use those insights to inform strategies to strengthen such areas. Which brings us to my role within the project. So the food system surveillance project is currently in its first year of the time. And to lay the foundation, I supported an environmental scan by screening and collecting data from grade literature reports to develop an understanding of the current system. And building on the initial scan, I used a snowball sampling method to identify key actors within the system and develop a database. Next, I supported the quoting of qualitative data to highlight key patterns within the surveillance system. And additionally, I supported another related project by the Public Health Agency of Canada with recruitment and data collection for their food and nutrition indicator framework by reaching out to academic experts as potential participants to gather insights on prioritizing food surveillance indicators. So the role of these tasks within the food system surveillance evaluation is to help understand the kinds of surveillance activities that organizations across Canada are conducting, how they are using that data, and how they're using that data and how it relates to food system policy. So this experience has been very valuable to me by improving my skill set in the following areas. Software use, for example, using Produce for data coding, or Excel for database construction, and Canva for dissemination. Moreover, I've improved my critical appraisal skills through the academic literature review, as well as systematic screening and coding. And most importantly, scientific communication skills by translating the research knowledge from another project that I've supported, which is known as the Wildlife and Pandemic Prevention Project, into social media posts to inform audiences from a non-technical background. And the best part of this experience was being able to
connect my academic knowledge of global health dynamics to a real-world application and getting a sense of what working in the research field is like. And to wrap everything up, I hope to continue developing my skill set from opportunities like these and to explore the health field before deciding to go with a master's in health for research or attending medical school after my final year of global health studies this fall. And once again, thank you all for your time, and I'm very grateful to my supervisors and everyone at the Dahdaleh Institute.
Thank you, Serina. That's great. Our final presenter this afternoon is Shah. And I'm going to see if I can get your name before it's properly pronounced. Shah Kheradmand. Yep. Shah Kheradmand. And Shah is working with Puya Razai, a professor, School of Engineering. And Puya is deeply involved in some really amazing research and is a fellow here at the Dahdaleh Institute. And Shah has been working with Puya to assist with advancing research on collagen scaffolds. And so collagen is a protein that is vital to structure of the human form. I mean, I'd be much more precise, but I think let's just say general. But it's a vital protein, and understanding how the protein relates, protein strands relate to each other, and how structure is built using those proteins is really important. So Shah has been working with Puya to do that and to advance research on collagen scaffolds, including fabrication and imaging. And the title of Shah and Puya's presentation that Shah is going to do is Cell Culture on Collagen Scaffolds with Basement Membrane Lining. Thank you, and you're welcome, Shah. Please, over to you.
Hi, everyone. So I'm Shah, and yeah, so I want to start off with thanking the Institute and our great symposium organizers and my supervisor for everybody for allowing this to happen, letting me improve on this. So the title, as James said, is Cell Culture on Collagen Scaffolds with a Basement Membrane Lining. So first, I'd like to talk about the general goal that we're trying to achieve here. So we made these scaffolds over at least we worked on making them over the past year and a half. So we've been working on a recipe to actually fabricate them.
Scaffolds of collagen.
Yeah, the collagen scaffolds. Yeah, and now for the summer, the main goal has been to actually culture cells on these scaffolds. So first, about our structure. So this is what they look like from the top view. So you can see the top layer is a 2D membrane. It's very thin, and this is the first layer. And the second layer, this is from a side view. You can see it's a spongy-like layer, and this is the 3D matrix. And then this is when we started the cell culture. So we first started with just a 2D layer, because we wanted to make sure that you can viably get any growth on the material. And you can see the 2D layer here on the 6-well plates. So it's very thin, it's transparent. And after seeding cells on it, using our media and our seeding densities, this is the method of imaging that I followed. So because I wanted to get a large sample size of my plates for increased precision and accuracy. So I did 3 lines of imaging and 10 images in each line. So a total of 30 just in different parts of the plates. And after doing it, these are the results. So first I did a control group. So a group without any collagen on the plates. So just cells. And also we use 3 cell lines for having a variety of cells, showing that they can actually adhere to the plate and also to collagen. So just to summarize this up, so overall, the cells were able to viably grow within the 293T cells. So in 293Ts, HEP2s and HEP2Ds, 2 different cell types, they were all growing well. But on the HEP2s, as you can see, the blue side, that's the side with collagen. So there was a little bit less growth, around 32, 40% But on the other cell types, not as much. So that could just be due to that batch just not being as just cells. They sometimes don't do what you want them to perfectly. So, but also for consistency's sake, I did 3 trials of each of these cell types. So this is averaged out. And another important thing here is we were able to find that cells tend to grow within the same pattern on control groups and on collagen. So if you plot this out on a line graph, they'll grow in the same spots. So just because I have collagen on the plate, it didn't affect where they grew. And this is also a sample of what I used to image with the 10 images like on the plate. So this is fluorescence microscopy, and we use an automatic counter on 10x magnification to count the cells. And an important thing here is you can see sometimes there's some mistakes with counting, like stuff like this, where it counts it when it's not actually a cell. And to avoid this again, that's why I did a large image count of basically 30 per plate. So the error margins are pretty low here. And the next step was to, after knowing that the 2D culture was successful, the next step is to do culture on the 3D structure. So first, you have to put the 3D on the plate, right, to be able to seed it with cells. But when we seed cells, the entire plate is full of media, which is mostly water with some glucose, right? So this, because it's a spongy-like structure, it will float naturally, right? So to combat this, what I did was, you can see here on the side there, that little, it's almost like our 2D structure. So, and also here, these little stains. So what I did is I poured a higher concentration of our collagen slurry prior to putting the sponge on the plate. And over time, when this dries, the sponge gets basically glued to the surface. And thankfully, when we seeded later on, this actually worked. So the collagen was basically stuck to the bottom and it wasn't floating.
So what's in that fluid?
What do you mean?
What's in that fluid that you're putting at the bottom of the?
Oh, just collagen. So when we make our collagen, prior to basically we have a slurry, which is basically bovine collagen powder mixed with acetic acid. We leave it at a suspension for 2 days, 48 hours, and then we polymerize that to basically make this structure. This is after polymerization. So first it's a liquid, and then it's a hydrogel mostly, and then it turns into this spongy-like matrix.
So you're basically using it as a kind of.
Exactly, yeah, but at a higher concentration. So at 2% instead of 1%. And the reason for that is here. So these slides kind of connect. So the reason I use 2% collagen instead of 1% is because this 3D structure is very weak to water. If you pour even a few drops, it ends up looking like this. So they completely collapse. So I upped the concentration. So there's less water. It's more, less water. So it didn't collapse, luckily. And for the next step, because media is also mostly water, right? So then I have to think of a way to make this structure resistant to being submerged in water for like 48 hours at a time. So we used ethanol as I use a cross-linker here, but can't be sure of that. But all I know is it does improve or strengthen the matrix. So after we submerge it in ethanol for around an hour and a half, what ends up happening is this. So they end up being resistant to water as long as they stay in water, right? So when we do our ethanol treatment and we take it out of ethanol, it'll still collapse. So you have to be very quick here. I had to basically do my ethanol treatment and immediately to cell culture. And here it's just a comparison image. So this left side, this is or was 3D collagen, so this spongy matrix, but without ethanol treatment. So you can see it's gone. But then the right side here, you can see how they're white and they actually still have that matrix structure. These have been ethanol treated and also submerged in media and incubated for 48 hours. So they've still kept their structure. And also I was able to see cells here. That's why they're pink, because we used DMEM. So our media it's a pink color. And this is the imaging of the 3D scaffolds. So you can see some cells here, and I should describe this. So the foggy area in this region, this is the glue that I used. So my glue is on the outskirts as well as under the scaffold. And then this white area, this is the actual 3D structure. And you'll notice you can't really see much through this. And this is what I'm working on currently, trying to fix. So it's can be for many reasons, like the plates might have to change because I use polycarbonate. So we might have to go to glass. And also just naturally the 2D, 3D scaffold is it's not transparent like the 2D, right? Like 2D alone. This is actually it's white, so light doesn't pass through it as well, and that's why this is happening here. But still, this still was partially successful because you can see there's still cells growing on the glue side. So if the scaffold didn't like inhibit any growth, thankfully, it's just a matter of imaging the scaffold side, the 3D side. And also, yeah, so the image is this image is with an inverted microscope. So maybe I can also try using an upright one where the lens is from up top, but I haven't had time to do that yet. So that's something that should be worked on. Yeah, so 3 general things I learned is I learned how to perform tissue culture. So this was my first time actually doing any type of cell culture. I also learned how to prepare the 2D, 3D scaffold collagen suited for cell culture with the ethanol treatments, right? Because for the last year, we've been making collagen for fabrication purposes to actually get the recipe right. But this time I was able to, like I had to actually perform treatments on it to make it suitable for any type of culture. And also I learned how to split cells at appropriate ratios, which is if you've done cell culture, you have to do this depending on your cells, you have to do it every 1 or 2 days, just so your cells don't overgrow and then die because lack of nutrients. Yeah, I plan to, I'm a 3rd-year undergrad going into my 3rd year, so I plan to focus on my studies as they come up. And also, I will continue my work with my supervisor, and I need to get done the imaging of the 3D scaffold structure that I said hasn't been done yet. I haven't been able to figure it out. And yeah, thank you all for listening. I hope you enjoyed, and these are my contacts.
Well, thank you, Shah. That was a great presentation, good demonstration of a national basic science application of the same kind of ideas that everyone else has talked about, the importance of precision, importance of replicability, the importance of breaker in every step of what it is that you're doing. And without that, we don't know if knowledge is new, if it's useful, if it's true, if it's false. It is the method that matters. In terms of determining the veracity of a particular intervention. I want to ask you, Shah, it was a great presentation. I really enjoyed the detail. I want to ask you, where do you see potential, assuming that this all goes in the way that you hope it goes, where do you see potential applications for this kind of research?
This is, at the moment, so I had on the first version of the slide that I sent you, so there was one extra photo there. And these scaffolds, can I go back to one slide?
Yeah, just a very short answer.
Yeah. So the scaffolds we have, right? We previously, on the fabrication end, we printed channels on them. So basically right here, there would be samples that have micro channels going through. So by doing this, we were planning on passing fluids through those channels, a microfluidic device. So if we can get cells to grow on this viably, we can control where those cells grow eventually, hopefully on those microchannels, and then that can be added towards the microfluidics process.
So that's the next step of your research.
Yeah.
The applications of that are things like human organs, creating human bone, creating human limbs or pieces of limbs for remedying various disease states. So this is really, really fantastic stuff. Collagen is it's the scaffold that gives form to particular functionalities of very specific kinds of cells. And so whether it's a liver cell or a spleen cell or heart cell or whatever, all of those cells are in some way structured around a scaffolding, which is largely collagen. It's not exclusively collagen, but collagen is one of the core elements. This is fantastic research, so thank you for that, and I wish you the very best for it. Serina, I have a question for you. Can you just tell us a little bit about snowballing as a method that you used?
Yeah,
That's the question.
thank you for that question. So snowballing is essentially a method where from the environmental scan, you have various resources and tools, and you just go over them and see what type of stakeholders or additional resources are there that are relevant to the research. And you take them and input them into a database for analysis in the next phase of research.
That's great. And I think the assumption is that when you start at a place and you can't necessarily predict where you're going to land in terms of gathering data points. But the assumption is that if you start and you use your starting point as a place to identify your next step. So you ask, you ask one of your interviewees, who would you recommend that we speak to? And then you go to that person. And then you interview that person, and then you ask that person, who would you recommend that we speak to for you? Then you go to that person. The assumption is that if you follow that until you reach a saturation point, which is essentially where you're getting all the same answers, you're getting the same answers over and over and over again. Then you know, well, we've covered them. That's the basic idea. But you start at a place, and like a snowball, it grows as you roll it through the snow and into something that is usable, right? That you can pick up. Welcome to snowman. But that's essentially the idea. So thank you for that. And I also wanted to ask you just about your own future plans. You're thinking about medicine or a Master's of Science. And are you thinking about these as kind of mutually exclusive options, or is one a kind of a backup to the other, or will you do both, or what do you think?
Yeah, I realize that they're both interconnected, and the health field is really big. So I'm really interested in health as a whole. So I still want to explore my options and see if I want to work in something related to prevention or treatment or even both.
That's great. And that is a terrific answer, because they're not mutually exclusive.
Yeah.
Many people go and do a medical degree, and then they realize, oh, wow, I really want to focus on prevention. And then they do a master's degree, or they do a residency in community health and wellness. And many people start in their undergrad, then they do a master's degree in prevention or some aspect of a clinical application, for example, or a public health application. And then they decide, well, I really want to do this. So for all of us who are thinking about our futures, whether it's medicine, public health, it doesn't really matter, or other domains, it's very important to kind of recognize that things aren't always mutually exclusive, and that one thing can lead to the other, and that it doesn't really matter which one you do first. You'll kind of end up in the same place, but the point is to go forward. Right? Don't lock yourself into something prematurely. So I congratulate you for thinking in that way. It's very wise. And then a question for Arabi. I loved your presentation, and I just wonder what is a systematic scoping review? Do you have an operational definition of that?
Yeah, so for a systematic scoping review, in the sense what I did was that I gathered literature that kind of looked at the evidence between AMR and its connection to food systems. And through that process, what we did is that I looked at the abstract and reviewed the abstract to see if that matched into the criteria that I was looking for. And forming data charting farms. So like looking at the specific aims of that study and what the results stated, and just gathering evidence like that kind of also helped in organizing my information that I needed for my review. And yeah, so that was like something that I did. And also coinciding with that, I reviewed national action plans of each of the countries, which kind of gave evidence to that kind of grounded the fact that we do need to have AMR interventions within the food system.
And what other, when you looked at when you compared national action plans, having done a systematic booking, I mean, what were some of your main findings? One more main finding. Just give us one more example.
Yeah, for sure. So majority of the literature that I reviewed were like observational focus, in the sense that they were looking at like specific bacterias and genes and how they were prevalent in certain animals and comparing with the animals. And regardless, they saw that increased antimicrobial use did lead into increased prevalence of these antimicrobial genes and becoming more resistant pathogens. And also that for preventive measures such as weak biosecurity measures or weak and monetary and not that much training and awareness within farmers or veterinary practices also contributed to increased antimicrobial resistance. And some of the papers that I looked at were also intervention focused, such as implementing AM regulations, reducing the use of certain antimicrobials, also countered with reducing antimicrobial resistance, but not just AM regulations, but also there's also like, we need to understand that it's not just about the use of antimicrobials, but also how we use it, and make sure that we have antimicrobial stewardship and like prevent, and also implementing other kind of alternatives such as enhanced training, awareness about the topic, and practicing stringent hygiene measures can also help in reducing antimicrobial resistance.
That's great, Arabi. Thank you. Your presentation was really, really helpful and comprehensive. So thank you for that. And the final question for Lauratou. Lauratou, I loved your presentation on knowledge mobilization and translation. I thought you did a nice job offering distinctions between them, but also similarities. And it seems to me, when I listened to you, it seemed to me that knowledge mobilization and translation is really about storytelling in a particular way for a particular audience. Do you want to comment on that idea?
I think you hit the nail like right on the head. I do want to say that knowledge creation is absolutely a critical part of the whole process. I think society wouldn't be anything if we didn't have researchers and scientists gathering and compiling and working together to do it. But I think when we talk about public health care and the focus on outreach and promotion, it's really important to understand our audience because we can do all of this work, but it won't have all of the real life impacts that we look forward to if no one can really understand it or understand why they should want to know more about it. I think specifically for our leaders, because leadership doesn't, like, it's very broad, you know, it doesn't always encompass you being in the science or medical field, but if you can grasp these concepts, you will be able to tell the story. So you could touch like nations, you can touch companies, you can touch countries and groups and everything else in a way where they will be like, oh, like I need this information because it's important to me in this way and I can benefit from it. So in order to do that, yeah, it definitely needs to be translated for specific audiences.
Great, thank you, Laura. I wish you the very best.
Thank you. I'm very excited. I appreciate that.
And especially in art therapy, I mean, that's kind of listening, kind of trying to help a particular person or a group of people tell their story, discover their story, tell their story. And so I wish you the very best for that. I
appreciate you saying that. Thanks.
So I'd just like to thank everyone for it's a great day. Some wonderful presentations, really, really clear
articulation of some very complex ideas. To me, what's most evident, again, as I said earlier, is the learning, how far you've come. And it's so gratifying as a professor. There's nothing more you want to see as a professor is to see people who will come from here to there. And not only from here to there, but to learn the skills that they need in order to go from there to wherever on their own without you. And that's part of the job. That's part of the joy, right, of the work, is to see people to acquire those skills. So that you know, I mean, I'm just listening to you guys, and I can be very confident no matter what any of you do, you're gonna be fine. You know, you're gonna do good work and you're making real contributions. You've got great minds, great hearts, great intention in terms of what you're trying to achieve. And it's very gratifying. And I just want to wish you all each the very best in the futures and in the past that you take. So thank you for great presentations. Our next event, formal event, will be our annual general meeting, which will be on September 5. And it will be at 1 o'clock, a 2-hour event. Myself and Professor Mary Ruktorowicz will be hosting, and we very much invite you to come and participate. Give us your thoughts, your feelings, your reflections, insights, and look forward to that. And you can see more information both on the AGM, but also on the seminar series, which we will be hosting here at the Institute as usual every Wednesday. All of that information is available on the website. And again, thank you for a wonderful Global Health Interns Symposium, and we'll close it. Thanks.